इम्पॉर्टेंट शॉर्ट नोट जो बहुत बार पूछी गई है एग्जाम में, एडक्टर कैनाल, इट इज़ ऑल्सो कॉल्ड एज अ सब sartorial canal because it lies below the sartorius muscle, or it is called as a hunter's canal on the name of scientist Hunter. So this is asked most of the time as a short note, और वाइवा में भी पूछे जाते हैं why it is called as hunter's canal. Okay, now let's begin with the what is adductor canal. So first we write the introduction. So what is hunter's canal or adductor canal? Adductor canal is also called as a subsartorial canal because it lies beneath the sartorius muscle middle part. It is called as a hunter's canal on the name of the John Hunter, which is who is a surgeon. Okay, what he did, he's a in case of popliteal aneurysm, he ligates the femoral artery in this region, and that's why it is called as a Hunter's canal. So it is very well known surgeon at that time as a vascular surgeon. So popliteal artery cases are operated where the first femoral artery is ligated in this region. So they identify this region, so that's the name given. Okay, so what is adductor canal? It is a intermuscular space where it is situated, this space in the middle part of thigh on the medial side, mostly on the medial side in the middle, where below the sartorius muscle, that is the where it is situated. So middle 1/3 of the sartorius muscle, it is intramuscular space, that is called as the adductor canal or subsartorial canal. That is where it is situated. What is the extent from where to where it lies? From the apex of femoral triangle, to there lies the tendinous opening, or there are some openings lies in the adductor magnus muscle. So from the apex of the femoral triangle to the tendinous opening of the adductor magnus, there is the extension of femoral triangle, adductor canal. So adductor canal अगर ये इस तरह से है तो इसके अबव femoral triangle है, एंड नीचे it is communicating with the popliteal fossa. दोनों के बीच में जो कैनाल है that is called as the adductor canal. So it extends from the apex of the femoral triangle and opening which lies in the adductor magnus muscle. So tendinous opening of the adductor magnus muscle. Shape in a cross section, it is triangular in shape. So that is the shape of the adductor canal. Then comes to the boundaries of the adductor canal. Now in the boundaries of the adductor canal, अगर हम क्रॉस सेक्शन दे दें तो ये फीमर बोन है. ओके, इसकी मेडुलरी कैविटी है. ओके, फिर एंड यहाँ पे एक बड़ा मसल आएगा, दैट इज वास्टस मेडेलिस. फिर यहाँ पे आएगा सार्टोरियस. Deep to it, there is the plexus of the nerve, and there is a deep fascia which lies deep to it, and posteriorly there lies the adductor longus and magnus, upper part longus, lower part of the magnus. So this triangular space is known as the adductor canal. Okay, so what are the boundaries? There is, and this part anterolaterally there is a vastus medialis muscle. Okay, medial wall is a form by the sartorius, deep fascia which lies beneath the sartorius and subsartorial plexus of the nerve, and the posteromedially in the upper part adductor longus and lower part adductor magnus. So these are the three parts or three walls, anterolaterally, medially and the posteromedially. Okay, or we can suggest anteromedially, anterolaterally and posteromedially. So anterolaterally there is vastus medialis, medially or anteromedially there is a sartorius, subsartorial plexus of nerves and the deep fascia, and the posteromedially there is adductor longus in the upper part and adductor magnus in the lower part. Okay, these are the boundaries. What are the contents? Now in the content there lies the first femoral artery. Deep to this femoral artery there lies the femoral nerve, femoral vein. Then there lies the Syphilis nerve, anterior and posterior division of obturator nerve. Okay, then there lies the nerve to vastus medalis. So nerve to vastus medalis, anterior and posterior division of obturator nerve. Then there is a Syphilis nerve. Okay, then femoral artery and the femoral vein behind it. If we say anterior to posterior, the structures is like this. First there is a femoral artery. Behind the femoral artery there lies the femoral vein. Okay, then there lies a nerve along or crosses anteriorly from lateral to medial. This is the Syphilis vein or Syphilis nerve. Okay, then there is a branch of, that is a descending genicular artery, which is a branch of femoral artery. Then in the medial part, anterior and posterior division of obturator nerve and the nerve to vastus medalis and obturator nerve. और यहाँ पे आएगा पूरा के पूरा ये adductor canal इस तरह से. Okay, so these are the contents of adductor canal. So femoral artery, from the apex of the femoral triangle it goes downside in the adductor canal and exit from the opening in the adductor magnus and continues as a popliteal artery behind the knee joint in the popliteal fossa. Femoral vein lies dorsal to the femoral artery. In the upper part it lies medially, in the lower part it lies laterally. Syphilis nerve crosses from lateral to medial side from upper to lower part in the adductor canal, and laterally there is a vastus medial nerve to vastus medalis, and in the upper part medially the two divisions of obturator nerve. So these are the contents of the adductor canal. Then you can write here about the applied part. In the applied part, what you can write? There is the adductor canal block for the local anesthesia to block the Syphilis nerve that carries the cutaneous sensation, and the compression of the femoral artery if it travels in a narrow space. That's why if these muscles get hypertrophied, there is a neurovascular bundle, this get blocked, and that will lead to the hampering of the blood supply in the lower part of the lower limb. That will lead to the typical claudication type of pain in the lower limb. So that is about the adductor canal. It's also very important short note, आपके एग्जाम पॉइंट ऑफ व्यू यूनिवर्सिटी एग्जाम में काफ़ी बार ये पूछा जाता है. ओके, so that is whole question about the short note about the adductor canal.